Thank you very much, Mr. Chairman. I want to make some clarifications and then definitely have a couple thoughts and questions. Just for starters, I know we've been hearing this here from some of my Republican colleagues. I think it's important to note that the CDC constantly engages with numerous groups, of course, during any sort of major crisis or process. There were stakeholders that were brought in to talk about how we return to the classroom. This was very common. I think there's obviously an attack going on here on teachers associations and teachers unions and generally teachers as a whole. And so I think that's very distracting, considering that the Biden administration, within 3 weeks of being in office, put together a plan to reopen schools. As we may need to remember that schools were closed during the tenure of President Trump. That's when most of the school closures actually happened. And so just want to put in perspective that the Biden administration did put in a plan to reopen schools. Now, that resulted, of course, 60% of schools reopening in a matter of months and more than 95% of schools reopening 1 year into his administration. So it's important to be critical, but also to make sure that we're being fair in when schools closed and when they actually reopened. It's standard practice for the CDC to engage with impacted organizations like teachers' unions and others to get feedback to ensure guidance is comprehensive and implementable. I mean, at the end of the day, the teachers are the workers on the ground in the classrooms. Their opinions, and particularly opinions on safety, is important. And so I think that's critical. Teachers and teacher associations are one of more than 50 different organizations, ranging from parents, superintendents, business groups, and others that all were a part of these decision-making processes as it relates to schools opening and closing. So I just want to make those notes. And with that, I want to just turn to some other thoughts. This is a very important topic. I want to thank, of course, all the witnesses that are here. And it's important that we always engage with teachers, staff, parents, most importantly, as we have these decisions in serious crises. So I was the mayor of Long Beach before being on this panel. I was served at the height of the pandemic. It was horrible and really difficult to see, of course, not just school closures, but business closures, and the single largest life of death event where we lost over 1 million Americans happened over these last couple of years. We have to always put this crisis in context of the lives that were lost. Back in Long Beach, we were the first large city in the state of California to actually vaccinate all of our public school teachers. We were also the first large school district to reopen our schools because all of our public school teachers were actually vaccinated. The White House actually called the Long Beach vaccination process a national model because we were committed to safe reopening of schools and working with our teachers on the ground. And this was all, by the way, in spite of very little support that we received from the Trump administration early on, no plan on how we're going to reopen schools. And so again, I think it's important that we look at the totality of what happened during the pandemic. As someone that was on the ground in California, I can tell you that the lack of concern from the administration, from many colleagues in Congress, some of which continue to serve, was very distressful for mayors on the ground. But we are serious today, and I'm glad the committee is serious about addressing the impacts of the pandemic and school closures. And I wanted to turn this real quickly to Ms. Mazik, if you can answer a couple quick questions. Is it safe to say that a reckless reopening process without vaccines or safeguards would have been damaging, particularly to the health and possibly lives of folks, not just in our schools, but those of family members back home?
Yes.
And is it also true that during the pandemic, families that were impacted oftentimes the most were low-income families, communities of color, where there weren't choices about being able to quarantine in separate bedrooms, but perhaps you had multifamilies living in the same apartment. You had kids that could have been in school and bringing back the virus to grandparents or other parents. Isn't that also true?
That is true.
Thank you. And I'd like to just finally, as we move forward to put in better safeguards, do you have a couple additional pieces of advice for schools or school leaders that could keep us healthy as we move forward?
I think it's important to understand that when preparation for a pandemic or any emergency health situation is a must. And schools need to bring together stakeholders in the community, and including health departments, but also making sure that the right people are at the table. We've had a lot of lessons that we've learned over the past 3 years on how to layer mitigations, how to make buildings safer, how to keep people safe. And it's incumbent upon us to begin those planning conversations, making sure families are at the table and all the other stakeholders who would be involved.
Thank you so much, and I yield back.